Hey everyone, for those that don't know me, because I'm going to be posting this in a few different places, my name's Kelly and I'm a physiotherapist. I'm also a melanoma patient and have had 5 wide local excisions now, and for those fellow melanoma patients that are going to be watching this, you'll know what that means. So I've had 5 primaries. I've also had a lot of other surgeries as well. So I think I stopped counting last year at 33 incisions with regards to melanoma, and I've had a lot more since then, so we're probably well over 40 if not up to 50 now. Also I've had other surgeries for hip issues as well. I've got kind of a form of hip dysplasia that I've had since a child, so I've had femoroacetabular impingement probably since I was born, and I've had several hip reconstructions with regards to that. And the reason why I'm telling you this is because this video is all about scar management. So not only do I know about scar management in terms of physiotherapy, and I'll tell you about that in a second, but also from a completely personal perspective. So I've had a lot of surgeries and I've got a lot of scars, and I manage them really quite well, to the point where I've never really had any issues with them. So, and that's down to what you do from day one, pretty much. And it's important for me to tell you this because you need to know that I'm qualified to give you this information. Also, a bit of a disclaimer, I can't be held responsible for anything that happens as a result of what you do with regards to the information that you get from this video. So always seek professional advice from your own healthcare team before embarking on any kind of new routine with regards to scar management. Physiotherapist scar management, you might think, where's the link? Well, physios kind of deal with anything with regards to physicality. So anything of the musculoskeletal system I'm going to deal with. I've got colleagues that are in physiotherapy that deal with things with regards to, you know, rehabilitation from strokes and, you know, cardiovascular issues and breathing apparatus and all those kind of things. So physiotherapy encompasses anything that is regarding your muscular system really and your skeletal system. So if you have a scar, it can end up having an impact on other structures. And to give you a very classic example, there's 2 examples of scars really that I see in clinic. The first one is following breast cancer, so a mastectomy. And often, sadly, I've seen patients that have had probably mainly historical, so they've maybe had their mastectomy a couple of years, and they've developed maybe cordon, which is basically where the scar tissue kind of forms in quite a solid line, and that kind of pulls the joint and the musculature around the scar tissue into it. And they can develop something called tethering as well, which is basically where the scar tissue attaches itself to structures underneath the skin. And this can all impede movement. And of course, that's my job, to keep people moving. So that's why I see those kind of patients. Also, the other scars that I see, not so much of at the moment, but I have gone through space where I've seen lots of them, because all of my business pretty much comes through word of mouth. So if somebody's had it, come in for treatment, they end up, you know, chatting amongst other friends that maybe have the same issue, and lo and behold, you get quite a few of them. So the other one is cesarean scars. So cesarean scar, that's it, off you trot, you've had your baby, everything's amazing, wonderful, away you go, and nobody really tells you what to do with your scar. And sometimes, very infrequently, so please don't worry, but sometimes that scar tissue can migrate and attach itself to other structures such as bowel and bladder, and can cause hideous issues. And then often you will need a scar revision, and it's really trying to get into those patients and saying, right, let's make sure that that doesn't happen again. And this is a bold claim that I'm going to make, but if scar tissue is managed effectively from the beginning, there need never be a problem. So on the feed that I've seen on Facebook, melanoma patients stage 1 and 2, I see a lot of people asking about help with regards to scars and how to manage it and what to use and all the rest of it. And it horrifies me that that information isn't available with the NHS or with even private patients who have these surgeries. And, you know, at best you get a sheet that maybe says, you know, give it a bit of a rub with some cream, and that's it. So I really feel that if we can educate people and get folk looking after their scar from day one, then we shouldn't have hypertrophic keloid scars, any cording, any tethering. Yes, you are always going to have the unlucky few, but if you really look after it and you follow the advice that I'm about to give you, then hopefully, you'll not have any problems. So first things first, different kinds of scars. So the first kind of scar is just normal, regular scar. Yeah, a nice white, fine line and everything's hunky-dory. But sometimes you might just luckily get one of those. But oftentimes you need to put a little bit of work in to get one. Then you've got hypertrophic, which is where maybe the fibres, so let's be honest, collagen fibre is what a scar is. So scar tissue is basically collagen fibres that are laid down. Now usually they're in like a nice basket weave, so it's quite strong but quite uniform as well, and it moves really nicely and everything's hunky-dory. When you have a hypertrophic scar, it kind of comes a bit gnarled, which is really what scar tissue is meant to do. It's meant to make that area stronger, knit the two sides of the skin and all the underlying tissues together, so that everything's okay again. But sometimes you can get lots more collagen in that area and it become a little bit hypertrophic, which is just basically where you've got a bit more scar tissue but it's contained within the scar. And then next stage up, you can get keloid scars. So keloid scars is loads more collagen again. But oftentimes with a keloid scar, it expands beyond the scar. So you've got your scar, you've got all your scar tissue, and then it kind of migrates and becomes quite a bit bigger. It can do anyhow, or very, very raised, or very angry. So first things first, if you've got any issues with your scar, speak to your healthcare professional. Make sure it's well sealed before you start any management. Make sure you don't have any infection in it, no angry redness, no heat, no pus, no seepage. So you really want to make sure that that scar, if it's got any physical stitches that you can see they've been taken out, or if it's got any dissolvable stitches that might take ages. Thank God, believe it or not, I had one dissolvable stitch that worked out of my hip 6 years later. So sometimes they can stay in there for forever. So you don't have to wait till dissolvable stitches have dissolved. You just have to wait until that scar is nice and closed, and then you can start doing some stuff with it. So first of all, I'm going to talk about this. I don't get paid by these people at all. It's a cream that I've used forever within our family. Even before you could get it in the UK, we used it for all sorts of stuff. And it's called Skin Food, and it's by Weleda. It's completely natural. It is quite strong smelling. It's got lots of essential oils in it, but it's amazing, and a little bit goes a long way. You can get various different kinds of Skin Food now, but this is the original, so it's quite thick and you need the teeniest bit. If I was to have used this on all of my scars, which I have, with various different tubes, this would still be going like 5 years later. I was diagnosed in 2015. Honestly, a tiny bit goes a long way. So I'm going to show you what to do with your scar once it's healed. Now, healed, I would say, probably takes about 7 days. So after 7 days, as long as you've got no kind of real huge scabbing, no seepage, and no areas that have opened up, then you're good. Or after your physical scars have been taken out, if it looks okay, if it looks completely sealed, then you're good to have a good go at it. I'm going to demonstrate it on my own head, where I had a wide local excision, so I'll kind of show you here. So that's that there. That was last year. Now, I personally think that's cracking, really. What you really want from a scar is for it to move. So if you look at this, it kind of moves. It's not really fixated. I mean, obviously, you haven't got a lot of movement in the forehead anyway, but it's not really fixated. So if you see, I can move that scar around, and that's really what you want. That means that the scar tissue underneath hasn't tethered it to something else. It's literally just knitted the two bits of skin together, underlying tissues together, so that things are as best back to the way they were as possible. So what I would do, and what I do, and I still do it with this one actually, just because it's on my head, and I don't know, it feels quite nice to rub. So the other thing as well is, it's not just a physical thing, it's not just an aesthetic thing either. So it's not just about moving the scar around and making it, look kind of not so bad like this. It's also a case of desensitizing it as well. So you might find that when you've got a scar, it feels really weird, it feels funny. It's like, you might get a bit pins and needles, you might get numbness, you might just get sensations in that area that you've never had before. And actually the best way to address that is to desensitize it, and the best way to desensitize it is to actually give it lots of sensation, lots of touch. So you take this and you take the, like seriously, that is like, honestly, it's tiny, yeah, just a little tiny squidge, because you want enough traction. So what that means is when I'm moving or when I'm working across the scar, I almost want to be able to pick the skin up and move it, yeah, because that's actually what we're trying to do. We're trying to get that collagen fibre to lie in a much more uniform position, so that it doesn't decide to bugger off and go into other structures or attach itself to structures underneath, and it makes it really tight, and it doesn't move, and it doesn't feel great. So you get teeny bit of skin, like a bit of cream like this, and then I would always start quite away from the scar, so kind of here, and you're just taking 2 fingers if you can, and circles, quite firm, yeah, I'm pressing quite hard. You can see how like white my fingertips are going. I'm pressing quite hard just all the way along. Feels quite nice still, to be able to do that, to move it. Sometimes this scar is great, but sometimes it can get a little bit itchy, which again is just the nerves just, you know, still sorting themselves out. So give it a good rub one way or the other, go beyond the scar each time, and then when you're finished, that is it, by the way, a couple of seconds. Everybody's got seconds. Nobody can tell me they haven't got time to do this, because they have. If you do this once a day, awesome. If you do this twice a day, brilliant. And then at the end, you just smooth it out, yeah. So whichever way your scar is going, so I've got a corker on my shoulder here that kind of goes this way and this way. So I would always like smooth along that scar, and then this one I would smooth along that scar as well. So smooth along the way that your scar is. If you've got a purse stitch scar, so that's basically where they have cut a hole, and instead of then making it into a rugby ball shape and then stitching it up into a line, what they do is they take a running stitch around the hole and they draw it together, so you end up with like a puckering of the skin. If that's the case, if you've got a purse stitch scar, then you want to finish just by doing that, yeah. So you'd be doing this all over it, and then you'd be finished by going round in circles. So whichever way your scar is how you want to finish, because what you're trying to do is you're trying to encourage the scar tissue to loosen off and then smooth back out again. If you do that twice a day, you'll not have a problem. I'm pretty sure of that, yeah. You can't sue me if you do, but you can get in touch with me actually, and I really genuinely do mean that. If anybody is unsure or they're wondering if this is a good thing for them to do and they don't want to speak to the healthcare professional, then I'm happy to give bits of advice. Obviously, I can't give completely tailored advice, because that would then involve me taking full medical history and treating you like a physiotherapy patient. And sadly, especially in this climate, I can't give away that kind of stuff for free. But little bits of snippets, if you've got any queries about anything that I've said and you just want a little bit more direction, I'm more than happy to help you. But this is for all scars, so not just melanoma, but for any scar that you have, particularly people that have had a cesarean. Please, you know, get familiar with that scar really quite quickly, as soon as you can. I know it's awful and you might not want to tolerate touch, but the more you do it, the easier it becomes. And I am covered in scars, like seriously covered in scars, but I think they've all done really well, and I don't have any problems with restriction of movement. And the one on my hip is about this length, so it's a good old size. So yes, that's me, and I hope this has been informative. Sorry it's a bit longer than I thought, but that is scar management, and thank you for listening. See you soon. Bye.